Good afternoon. We're going to now begin the public briefing for the coronavirus from the Emergency Operations Center at Calcasieu Parish OEP. Brian Beam, Calcasieu Parish Administrator. We're going to start off today with our OSEP Director, Dick Grimion.
Thank you, Brian. And for the subsequent speakers, if you would, if someone asks you a question, please repeat it. We're having a little bit of sound problem today. Operations are about the same. I don't have anything new to report on that, but what I'd like to discuss today is a follow-up of something the sheriff talked about yesterday, and that is these rumors of a shelter-in-place or a mandatory confinement to your house or something. We have checked every source we can find, from DHS to the state to local, and we're not able to find any information about that. I can tell you from a local level, there's been no discussion of it. The sheriff was rather emphatic, I think, yesterday about that very issue. However, I will ask you to do one thing. If you get an email about this subject and it comes from a legitimate government email address, send that to us, and I'd like to follow up with that and verify where they got the information from. But I don't think it's from anyone here, and I don't think it's happening at the state level. The governor is having a unified command group meeting right now. There may be some further information today, but as of this time, we have no new information to report on that.
Our next speaker with an update will be Dr. Lacey Kavanaugh from the Office of Public Health.
Hi, good afternoon, everyone. Couple of things that I'd like to talk about today. One is that we do have some new cases within Calcasieu Parish. We currently have 3 confirmed cases here. I fully expect that as time goes on, we will have more, as there are many tests that are still pending from earlier in the week that we should be getting back in the next couple of days. And tests continue to be run at many of our healthcare facilities for folks who meet criteria to be tested. We currently also have some changes to the criteria for testing, and so that just went out today. So many of the providers in the community are going to be looking for that. And the best thing to do if you need to know if you have symptoms and need to be tested is to call your healthcare provider. Remember that symptoms of COVID-19 are going to be fever, coughing, shortness of breath. Those are the 3 main symptoms that we have been seeing. At this point, we are assuming across the state of Louisiana that we probably have some degree of community spread. This is no longer an illness that is just related to travel to other places. And so we all need to be taking those social distancing precautions that we have all been talking about for several weeks now. Pretty much universally, if you are sick, whether you have tested positive for COVID-19 or not, if you are sick, you should be staying home, and you should be staying home and isolating yourself for at least 7 days. And before you go out into public again, to come into contact with anybody else, you should be symptom-free for at least 72 hours. That means no fever for 72 hours, and that means not taking any fever-reducing medicines for at least 72 hours. So you have to have had symptoms for at least 7 days, be symptom-free for 3 days before you would undo that self-isolation. But you should pretty much at this point assume that anybody who is potentially sick should be isolating themselves, whether they've tested positive or whether they haven't tested positive. So if you're sick, stay home. That is the message. If you are sick, you should stay home. And so those are the main updates that I have. For the state level numbers, we currently have 479 cases, 10 deaths, and the state lab has run over 1,000 tests so far for COVID-19. So that's all I have for today. Thank you. Oh, yeah, I can take questions now.
Do you know how many tests have been running in Calcasieu Parish?
I do not have the numbers of how many of those state tests were running Calcasieu.
We've been getting phone calls from a number of people who feel feel like there is more information they should be able to get on the people who have tested positive without violating their privacy or whatever. For example, let's say a person, lives in Starks, then people in Lake Charles might breathe a sigh of relief and say, I never go to Starks. So what, if anything else, can you tell us about these people?
So to repeat the question, we're being asked what things about the individual cases in the parish, what information can be released about those cases. And right now we are only releasing the parish level data. So how many cases are within the parish. We're not releasing specific zip code level data. That may change over time as we get more cases. We are going to be putting together at the state level some profiles of the average ages of both the cases that we've had and then also the average ages of the people who are deceased from COVID-19. But that data is currently only available at the state level, not at the parish level, because we only have 3 cases, and so we can't release that sort of information without violating privacy. So in terms of that's the only information that we can release at this time. As that changes and if that changes, I will certainly be the first to tell you.
We're still getting complaints from people who work at various places, and even I think people who are taking children for babysitting or daycare, where they don't feel that social distancing is being practiced. I know you can't control what everyone does, but is there anything more that you can say about that, or should they be reporting that information to a particular government agency or anything like that?
So the question is, what about places in the community that we feel are not following those social distancing recommendations? Well, I can definitely I can't speak to the enforcement side of that, so I'll let some other folks answer that question whenever they come up to speak. But from the medical perspective, I will tell you that social distancing is definitely saving lives, and if people are not doing it, that definitely that makes me sad, because I do think it is extremely important. I would not be up here telling you to do it if I didn't think that at the end it was going to make a huge difference in how well our community does. And so I definitely strongly encourage everyone to try to follow those guidelines. We understand how difficult it is to stay 6 feet away from people. Sometimes it's impossible, but we can all do the best that we individually can, and I strongly encourage everyone in our community to do their best.
And what is the magic number that constitutes fever, and what would be the go-to things that you would do at home in order to try to treat yourself and get well? For example, my big thing has always been Mucinex. Are there any particular things that you can recommend?
Right, so she's asking self-treatment at home. Number one, what qualifies as a fever? So the definition of fever from the medical perspective is 100.4 degrees or higher. And asking about self-treatment. So what sort of things can you do and take at home to make you feel better if you're homesick? Well, definitely Tylenol would be a good thing to take. There have been some scattered reports that maybe ibuprofen is not the best fever reducer to use in the case of COVID, although that's still very preliminary data and it may very well be disproven going forward. So, but if you're able to take Tylenol, and you could take either ibuprofen or Tylenol, I would choose Tylenol right now to reduce fever. And it depends on what your symptoms are. I mean, if you've got nasal congestion, then I would recommend a decongestant. For example, Sudafed, as long as you don't have high blood pressure. If you're coughing, then I would suggest a cough suppressant. So there are many of these types of medicines over the counter. Lots of these medicines are combination products, meaning that they might have all of those ingredients. So it might have an antihistamine and a decongestant and a cough suppressant all wrapped into one. So you see your multi-flu symptom sort of products. And so those would, for the most part, also be appropriate to take in this case. So I always say treat the symptoms that you have, and there are many products available over the counter that can help to alleviate some of the discomfort that comes with those symptoms.
People are also asking about drive-through testing. Is it available, or should it be available?
So right now, it is available in a few locations across the community. I would definitely say that those sites are changing pretty often. And so the best thing to do is to call your health care provider where you live, or to call 211, because 211 is keeping track or trying to keep track of testing locations that are sort of identified within the community. But not all of the locations are for sure registered, so definitely talk to your doctor about advice. Whether testing locations should be offered in a drive-through fashion, I think there are a lot of benefits to that, because that helps to reduce exposure to healthcare workers and to folks who are, say, working in the ER. There is a location like that available. Although there are a lot of logistical challenges with that, I think it's a pretty good practice that other communities have kind of started to explore, but I think time is going to tell if it turns out to be the best way to handle those cases. Once again, it is something that is rapidly changing and evolving, and but in general, I think that drive-through is a pretty good deal to help to reduce exposure.
But I mean, should that be primarily for people who have symptoms? Because I was wondering, let's say you go get a drive-through test and it says you're negative, and you're not really negative, it just hasn't kicked in yet. I mean, how long after exposure would it show up in a test?
So symptoms show up anywhere from 2 to 14 days after exposure to the virus. So we think that you are the most contagious once those symptoms start, much like other viral infections, right? And so, yeah, if you were exposed and you have no symptoms and you went and somehow got tested, that would not meet current testing criteria. But if you did somehow manage to get tested and you were asymptomatic, that doesn't mean that you couldn't then develop symptoms a few days later. So right now, the recommendation is to test people who have symptoms and not to test people who don't have symptoms.
Thank you.
Okay, thank you.
Okay, very helpful. Dr. Kavanaugh mentioned 211. Our next speaker is actually Denise Durrell, United Way Director, with an update on the data as far as what's coming in to the 211 system.
Thank you. Again, we just want to remind the general public that 211 is the place to receive that non-emergency information, and you can either make a landline or a cell phone call, or you can text us to 898-211. And as of this morning, I would like to let everyone know that our 211, the United Way 211, has actually handled 11,172 calls. And in addition to that, we have over 23,000 people who have used a mobile device to text questions to us. And again, those answers are coming directly from the Louisiana Department of Health and the CDC. So thank you.
We'd like to hear next from a couple of our elected officials from the Executive Policy Group. First will be Tony Gilroy, Police Jury President.
Thank you. I just want to say that the spirit of our community has been strong, never been stronger, and we will make it through this. And I just want to say that we also have our other local mayors here that are involved in the situation, and asking everybody to please wash your hands and stay the distance from everyone. Thank you.
You're going to hear folks repeat a lot of the same things today. That's not an accident, because it needs to be hammered home. Very simple practices, but very important. So thank you, Mr. Gilroy. We'll have Mayor Nick Hunter from Lake Charles next.
Thank you, Brian. Good morning, everyone. I want to start off by just saying thank you to some of the, well, really all of the City of Lake Charles employees. I think I can speak for every governmental agency when we say right now, there's so much going on, and sometimes we forget about the small things. But right now, public safety, water, wastewater, garbage and trash pickup. I mean, these things are still happening, and I just want to say how proud I am of this city, and specifically to our City of Lake Charles employees. I want to thank you for being the quality individuals that you are. I want to reaffirm some of the rumors about quarantine, shelter in place. City of Lake Charles has no intent to enact anything like that right now. Have not heard of any directives for any of those things to be issued, and I have received quite a few calls and questions about that. I'm not sure where those rumors are originating from, but certainly not from the mayor's office. I'd like to take a moment to talk about some specific efforts for homelessness, and I want to thank the Southwest Louisiana Center for Health Services for communicating some great bits of advice to the city, and we've been working on with them to try to identify some things that we can do for our homeless population, so thank you for that. I want everyone to know that we've printed up some pamphlets that talk about basic hygiene and the power of 211 and symptoms of the coronavirus. We're handing those out to our homeless population. Based on some directives just literally within the last 2 or 3 hours, the city will be positioning some mobile hand washing sinks at certain locations throughout the city of Lake Charles. And those will be daily, those will be updated daily so that we have some areas for our homeless brothers and sisters to have a chance to wash their hands. And again, we know it's not a perfect scenario, but we're at least giving them a little bit more to try and keep themselves clean and allow them to be able to wash their hands. We have been working with Abraham's Tent to try and make suggestions to them, and they have been wonderful partners. God bless Abraham's Tent and what they do every day of the year. But some suggestions as far as social distancing and abilities for individuals not to have to all go inside and congregate as sometimes they normally do. And I've been visiting with people from Water's Edge, one of the great community faith-based organizations. God bless Water's Edge and their all the individuals over there and what they do. They've told me that hand sanitizer is something they welcome right now, and I asked them if they needed anything else, and they said lots of prayers for this whole community, and I echo those sentiments. But as has been said before, tough times, but we're going to get through this together. And guys, this is not only government making this happen, these are everyday individuals, and it's a really beautiful thing. Anything?
We're continuing to have questions from our viewers. I don't know if this is yours or not, Nick. At what point do workplaces, including local governments, go to essential personnel only? There seem to be still a lot of people working on the streets, commingling, having meetings, all due to the fact that most are having to still work.
Please, can you repeat?
Okay, you're asking about at what point. I'm not sure if I understand the question really, Teresa.
At what point, I mean, I think that perhaps people already have, but the question is, at what point do workplaces go to essential personnel only?
Well, I think workplaces should be following the directive of the governor right now. I can tell you that we're doing that as a city, and the governor's directive was to ask for groups of 50 or more not to congregate, and I think businesses should be abiding by that today.
Somebody else is asking about the beauty industry, which I think it's kind of obvious, but, you know, what would you say to those who, I guess, want to go get their hair and nails done, if that's even a possibility?
You're asking an expert in the hair department about beauty. I'm really not educated to answer that question. I would probably direct that to Dr. Kavanaugh as far as beauty and things of that nature. She's much more educated on that than I am.
Well, I think we do have a couple more
Okay.
questions dealing with that. Somebody wants to know, will people on Social Security get stimulus money?
I have no clue on that, Teresa. I'm sorry.
Okay. All right, just trying to be thorough.
Absolutely. Thank you.
Teresa, on issues of the Social Security issue, for example, we do want to be able to help people know where to go. And I think certainly I may need help from Dick or somebody else. We've been saying all along, because most of the questions at the state level or local are related to health, and that's why we say ldh.la.gov or Louisiana Department of Health. For federal like that, I believe there's a central place, but I don't have it off the top of my head, but I think there's probably a place for questions like that. We just don't have that here, but I know there's an answer for that at the federal government level. And if somebody has that before we end today, I'll be glad to.
Brian, well, somebody has another answer.
Denise, did you want to?
211 should have.
Oh.
We have all the ESAP information. We
Oh,
just
okay.
budgeted
I didn't, I guess I should have thought, yeah, then call 211. I didn't know if y'all were giving information at that level, so.
We're trying.
If people want to know about things like Social Security or anything else, start with 211, and if they don't have the answer, they start collecting it so they can answer future calls.
Somebody wants to know whether to pay with cash or pay with plastic, which it seems reasonable that plastic can be more easily sanitized, but that's a question from a viewer.
That may be more of a health question. Dr. Kavanaugh, any thoughts, or that's too specific?
No specific thoughts. I mean, we always do say that cash sometimes, because it is a soft fiber, but I mean, can't tell people not to use money.
Yeah, so Dr. Kavanaugh, there's not an official position on that. Basically, I think what she's saying is certainly cash changes hands a lot, and that's why that's been mentioned. Just when in doubt, continue to clean all of that and wash right after transactions for anybody handling either cash or plastic type payment methods.
You know, some of the national media have talked about that Louisiana ranks pretty high up there as far as the exponential increase. Does anyone here have any thoughts on that?
She's asking about the incidence of COVID in Louisiana and being higher than the average. That is a question for Dr. Kavanaugh that I'll let her address.
Right, so I haven't crunched those numbers for today, but yes, even though our raw number of cases is not among the top handful in the country, we also don't have the population of some of the big cities across this country. So when we look at our rate of individuals per capita who have COVID, we rank in the top handful. I don't know, I think yesterday we might have been number 3, but of course that changes daily with the numbers that come out. But I can say that yes, we are a state that is very affected by this right now.
Any idea why we would rank high?
I can't speak to why we would necessarily rank high, other than that, of course, we are one of the most unhealthy states on any day. We usually rank close to the bottom of that list on an ongoing basis. And so we do have a lot of folks who have other comorbidities. So that, of course, puts us at high risk for folks who have complications from this. We also live in a culture, I think, that is very social. And remember that a lot of the cases that we are seeing now and today could have got infected last week or the week before all of these social distancing measures were really put into place. And so I think that that is why we are still seeing a whole lot of new cases, partially because not everyone has chosen to follow those recommendations, but also partially because those recommendations weren't in place when some of these cases were getting transmitted. And we do live in a culture that very much celebrates gatherings.
Thank you.
Teresa, what I would ask, I know you're getting new questions. We will have a point very briefly here where we can cover those in total because we have all the speakers still here. Let's give an opportunity for Chief Deputy Stitch Guillory with the Sheriff's Office to update things from the law enforcement side.
Thank you, Brian. Good afternoon. From the law enforcement side of things, everything has been business as usual. It's quiet. I've spoken to every chief of police in the parish. Nobody has any issues whatsoever at this point. It appears as though the public is taking heed to what's being asked of them. You know, myself, happened to be in the store this morning picking up some supplies, and I can tell you everybody was so nice to each other. It was very good to see. And you know, at the end of the day, we're in this together as a community, and it's important that we you know, try to help each other and go about things in the right way like we always has. That's what's great about our community. So from law enforcement, it's business as usual, no issues whatsoever at this point. Thank you.
Thank you, Stitch. And I know it's been said every day by the sheriff and Stitch and earlier by Mayor Hunter. Any news we get, we are going to convey to the public. And there's going to be rumors, but when you hear about things about shelter in place or quarantines, that sort of thing can scare folks, obviously. And so when we hear them, we're going to certainly communicate with the public. But we appreciate your time here.
Brian, I forgot to add while I was up there, we have no plans of instituting a curfew. The sheriff wanted me to reiterate that.
Thank you. Sheriff's Office is telling us there are no plans from them to institute a curfew at this time, any different than what's already on the books, which has been here long before the virus. So just want to emphasize that directly from the Sheriff's Office. At this time, we'd like to ask Jim Rock to come up, Lake Area Industry Alliance, for an update.
Okay, thank you, Brian, and good afternoon, everybody. I want to let everybody know, yesterday afternoon after our meeting, I had a virtual meeting via conference call with all the area site managers, and we went over where everybody was as far as their preparations. And I want to let everybody know that all the plant managers and site managers understand that these facilities play a critical role not only in the local economy but also in the state, in some cases nation's infrastructure. So they take that responsibility with a great deal of seriousness. All the plants are fully intending to continue to operate. They've identified essential personnel. They're making provisions for those essential personnel to stay in the facilities for extended periods of time if they need to, due to whatever the future might hold. So everybody's planning on running full out through all of this. We have been practicing non-essential people staying at home and working remotely. A lot of teleconferences, a lot of video conferences and emails and things like that to minimize the potential exposure for employees and contractors. Would like to address, in the last couple of meetings, there's been questions about social distancing and the challenges to meet those social distancing standards or guidelines in some of the facilities. And that includes shelters, like break shelters and lunch shelters, particularly when they're used for lightning alerts, when you have to have 100% of your population housed somewhere in some sort of a shelter to get out of the weather. And I reiterated those standards to all the site managers, and some of them told me some of the things that they've been doing to make sure that they were able to accommodate those standards. The other issue with the social distancing is in transportation. So some of these employees riding in the plants in trucks, and some of them are transported from remote parking locations to the facilities via bus. So I reiterated the standards there as well and suggested, and actually one of the plant managers talked about some of the things that he was doing as far as transporting his people in buses and making sure that social distancing was taking place there. And everybody heard that, so everybody understands the standards and is fully committed to meeting those standards. Teresa?
I don't mean to put you on the spot, but I guess it's my job. I showed you some pictures of people on a bus that were sent to me from a worker who has to take a bus to get to his specific job site. And, he felt like he was being crammed in there like a sardine. I mean, any reaction to the pictures I showed you?
Since I was 6 feet away from you, I couldn't see the pictures particularly well, but I could make it out that there were people in buses and things like that, but I don't know where those buses were, where the pictures were taken or when they were taken. So it's really hard for me to address something like that, but I would reiterate what I did yesterday. If I know of a specific location, specific time and date, and if I had that information, I could address it with the proper officials.
Thank you.
All right, thank you.
Let me just state in a general term on that last question. I'm in a public agency, obviously. The industries and represented generally by LAIA. There's similar issues. If there is a specific thing that we are made aware of dealing with one of our employees or how we're servicing the public, we have to know specifically more information to deal with it. And we do ask that that be reported through channels. And I feel comfortable speaking for all the local governments and other local agencies here that they would very quickly tend to the issue, the question, and find that out. It's just hard in these general public briefings to know that. It really depends on either the public agency or the company, and I think short of that, it's too hard to answer that in a general format like this. But we certainly want to make sure we know.
Well, the problem is that the people at the plants feel that if they reveal who they are or go to their supervisor, that they'll be fired.
Yeah, that I'm just going to speak for the police jury, and I know others have this. When we have policies in place that for whatever reason, if they feel that way, then they need to contact, for example, either the Human Resources Department or maybe legal counsel. We give them options if their immediate supervisor they feel is a part of the problem that's specific to that incident. And I think most companies and agencies have something similar. And at some point, it is up to that individual then to utilize one of those options. That would be, I think, I'm just speaking on our answer. I have one more thing from the sheriff's office. I think also by way of state police, there are no road closures. As far as I assume, Stitch, you mean, is there anybody blocking entrances into the parish or something? No.
All roads and highways are open.
All roads and highways are open, and I don't believe there's, obviously barring any changes, but there are no plans to do that. So all roads and highways are open. That's directly from the law enforcement agencies, including state police. So, thank you. I think that's all of our speakers. There may be other questions. We want to wrap that up, certainly, and give a chance for any questions that haven't come up already. Okay, looking ahead, right now we don't have plans to have this briefing tomorrow, which is Saturday, or Sunday. The next one is scheduled for Monday, March 23rd at 2 p.m. However, this is moving rapidly. We all know that. If there is a need, we will call it before then. But nothing today, as we speak, is scheduled. Continue to look at the websites we've talked about for updated information on state cases and anything else. And of course, we do all of these live, Facebook Live. You can watch this later. And any information, I'm going to speak for cities and all, any information that may change on garbage pickup or anything else, they will post on their respective sites. But at this time, just because Nick brought it up earlier, it's the same with the parish. We have all of our garbage pickup and other services there, and we are on a very reduced staff. That question came up earlier. And talking with the other mayors, it's a similar thing throughout. So we are providing services, but with reduced staff, greatly reduced staff, and we'll continue to look at that literally every day because the situation is that is changing that quickly. Let's put it that way. Thank you for coming. Have a good evening.